Hello, everybody, and welcome to Cozy Talks. Happy Ash Wednesday. Happy Valentine's Day. I'm going to go ahead and get myself connected to my Instagram channel while I give you guys a couple of minutes to jump on board. All right, and here we go. I'm going to go ahead and go live on Instagram. So I am live on Facebook, YouTube, and Instagram. Go me. All right, guys. I'm going to go ahead and give you guys, like I said, a couple minutes to jump on board. As you come on board, let me know who you are, where you're from, and what is in your mug this evening. Hopefully you have something special for Valentine's Day or Ash Wednesday, depending on what you're celebrating today. We got Don on board from Vancouver. Oh, we got my Canadians on board with his protein shake. Sounds good. All right, guys. Cheers. I am getting my hot chocolate in. It's one of those rare occasions in Florida where I can justify having hot chocolate, which is one of my favorite drinks. So we're going to go ahead and do that. All right, guys. As you know, I am streaming to Facebook, YouTube, and Instagram. So those of you who have a little bit of a harder time finding me on Facebook, you can try one of those other two channels. All right, we got some people coming on board. We got Liz here. We got Pam from Indiana, just pouring water. We got Scott from West Virginia drinking water. No, sweetheart, just me. Well, I'm glad you could join us this evening, Scott. Well, I'll be your Valentine today. We got Benny coming in from Texas with his water. We got Steve. Thank you. Happy Valentine's Day to you. We got Eric coming in drinking his water as well. All right, guys, I'll be popping back and forth between my Instagram channel. We got Mark on Instagram. Mark, I see you. I see you. We got Pam on Instagram as well. Guys, trying to get that little Instagram going there because it is kind of new to me this year to be broadcasting from there. All right, so I'm just going to kind of move my table just a little bit here. All right, guys. Hey, Pastor Dave. Yes, I am everywhere. That's what I tell my kids. I'm everywhere and I can see you. Just to freak out my kids every once in a while. All right, guys. So it's a fun day today. So it was interesting. Today I went to Ash Wednesday and you got my little smudgy on my forehead right there, ready to go, ready to start Lent. And it was interesting. The priest said that the coincidence of Ash Wednesday and Valentine's Day falling on the same day only happens 3 times every century. So I thought that was just kind of a cool statistic. Just, one of those useless Jeopardy factoids that are just important to know. So I thought that was kind of interesting. All right, we got Rob saying happy Valentine's Day from Mooresville, Indiana with his blueberry coffee. I haven't had that in a long time. I used to drink that every day when my kids were like babies and I needed to wake up in the morning. Blueberry coffee was like my choice, like the New England coffee blueberry cobbler. And I totally remember that. Hey there, Dave. How are you doing? Glad you could join us. We got the other Scott from West Virginia packing and listening in. Oh, 2 Scotts. Thank you. We got Marianne. Ooh, Marianne with 28 degrees. Holy smokes, it is cold. All right. We got Hugh coming in from Denver. All right, and I'm just popping back and forth. We got Paula coming in and Kathy coming in from the Instagram channel as well. Hey there, Andrea. There's my resident occupational therapist. Thank you for sending me the picture of that light gate. That was a really cool picture. All right, guys, we're going to go ahead and get started this evening. For those of you who are joining me for the first time, welcome. My name is Cozy Belloso. I'm a physical therapist, amputee specialist here in beautiful, sunny, cool weather Florida. It's like the best time of year here in Florida right now. So happy Valentine's Day to all the sweethearts out there. Happy Ash Wednesday to all my Catholics and Christians out there. So thank you for joining me this evening, guys. I know that my husband and I are going to be celebrating our Valentine's Day sometime this weekend because, we're parents to 4 kids. So going out on a weeknight, that just ain't gonna happen. So we're gonna have our Valentine's Day dinner. And guys, I'm kind of a hopeless romantic. Even during the years before I got married where I didn't have a Valentine, I always loved Valentine's Day. So for those of you who want to share with me tonight, I love to hear, like, what did your Valentine do for you? Or what did you do for your Valentine? I love hearing sweet stories. So post it in the comments section. I just like to read that. I just like to enjoy that. And maybe later on I'll share with you the sweet thing that my husband did for me today. Marianne says, I got the ashes too. I know mine are kind of like a little smudgy. I lost it. Just looks like I haven't washed my forehead. I lost my ashes because I went really early this morning. We got Jerry saying, Happy Valentine's here in Arizona, drinking white chocolate mocha coffee. Y'all got some nice drinks. Y'all need to send me some of these drinks. Oh, Rehoboth Beach. I know, Dave. It's been probably about 3 years since I've been to Rehoboth, and I love going there. There's this amazing sushi restaurant that's on the rooftop that I loved. Like when I go visit my in-laws in Maryland and we go to Rehoboth Beach, my brother-in-law always takes us there, and it's really, really good. We got Dick Devers coming in from West Virginia with his root beer. All right, guys, go ahead and throw some questions into the comments. I've got a couple of questions that y'all sent in, and I'll start with those. But as always, I got to keep the show going, so y'all got to put those questions in there. All right, let's get started with, I didn't print out. I have to look at my questions on the computer. Okay, this question came in through my texting messages. The question is, if Ronnie is on, I have a question on what one should expect a prosthetist to do when making a new socket to get a great fit. I understand his statement last year on how adjustability doesn't fix a bad fitting socket. So I don't know who sent that text message. By the way, guys, can I just put a little aside in? If you are sending me the Cultured Pearl, yes, that's the name of it. Yes, Dave, that's the name of the restaurant. You're good, man. So guys, for those of you who are joining me for the first time, I have a texting service. And with this texting service, when you sign up, and I'm putting the instructions here for you, I will send you the links when I go live. So it's just easier to find me. All you got to do is just click on the link that I send you and I go live. And I promise I don't spam you and I don't sell your phone number. But the other cool thing about my texting service, you can text me back. So it's one of those. And I paid extra for that. So I want you guys to use it. So if you want to be on my texting service, text Cozy Talks, all caps, one word, to that phone number right there. Okay. So the question that came in with the text was, if Ronnie's on board, which Ronnie was supposed to be here last week. Unfortunately, he had a family emergency and he's not here. He's out of town. So we have to reschedule his show. So whoever sent me that text, I will be sure to include that when he does come back on the show. Guys, when you send me your text messages, if you can do me the favor and just say, this is so-and-so, if you don't mind putting in your name, because I just like knowing who I'm talking to. So when it comes to a socket, what can you expect from your prosthetist, when you're getting to get a well-fitting socket? And Thomas, I see that you're on board this evening and you're a prosthetist, so feel free to chime in. That's kind of the bread and butter of the prosthetist right there. It's making a socket and making you a great fitting, well-aligned leg. And guys, it all starts with that socket fit. If that socket is not fitting properly, you're dead in the water. Dead in the water. And for me as a physical therapist, I can't do my job. Okay. I'm kind of good at what I do. I've been doing this for 23 years now, and I'm kind of good at teaching people how to walk. But if a person's socket does not fit well, I've got nowhere to go. And I'm just thinking of a perfect example. I have a beautiful lady who's coming to see me from out of town in a couple of weeks. And she's been trying to come see me now for a while. But her socket has not been fitting well. And I kept telling her, don't pay a plane ticket and hotel to come see me if your socket's not fitting well, because we're just not going to be able to do anything and get anything done. So when it comes to a socket fitting well, yeah, that is the prosthetist's job to get that done properly. And I know Ronnie will have a lot to say on that when he comes on the show. But from just a physical therapist standpoint, the fit it's truly everything. And it involves just not only getting the shape of the socket correctly, the suspension is so important. How you're suspending, how you're holding that socket onto the residual limb. And that's part science and also part art form I'm starting to learn. And let me just give you an example of what this person was referring to. So whoever sent that text message was referencing how Ronnie mentioned that an adjustable socket is not going to fix a poorly fitting socket. So here's what he meant by that. All right, we have these really great adjustable socket systems. They're made by Click Medical, and it's called the RevoFit adjustable socket system. Y'all have seen, if you've watched the show more than a couple times, you've heard me reference them. I am sponsored by them, and I do work with them because I like their stuff, right? So they have all these really great hoopy scoopy ways that you can put adjustability into your socket. What does that adjustability do for you? Well, it allows you to increase or decrease the volume of your socket with the twist of their reel. In this case, this one's a boa dial version. Okay. So it expands and it can contract, which is nice because you don't have to take your socket on and off to take socks on and off throughout your day. Okay. Now, is that the key to a well-fitting socket? No, it's not. It enhances a well-fitting socket. And even the folks at Click Medical will say this. Okay. If your socket is fitting poorly and you put adjustability into it, you're not fixing the fit of the socket. Does that make sense, guys? Okay. This simply allows you to expand or shrink the socket according to the needs of your limb that day. Okay. And believe me, it's a very, very handy tool. Okay. I like to use the analogy of a birthday cake. All right. You can have the most amazing chocolate cake, right? And then when you put the icing on top of that, chef's kiss, it just makes it the best chocolate cake, right? The cake is your socket. The icing is the adjustability, okay? Now, if your cake is like lousy, if it was made with expired flour, if it was made with like bitter vanilla and it just doesn't taste good, it doesn't matter what kind of good, amazing homemade icing you put on it, it's just not gonna taste good. Okay, so same thing with your socket. If your socket is not fitting well, I don't care what kind of bells and whistles you put on it, it's not gonna make it any better. Yes? Okay, let's see what people have to, I see some comments coming in, so I know people are gonna be talking about this one. Oh, Rob, you sent that text. Okay, thank you for letting me know. And Rob, here's your homework assignment for you because sometimes I get mom brain with 4 kids on the brain and things get lost in here somewhere. Okay, so Rob, when the time comes for Ronnie to come back on the show, I want you to resend me your question. I'm going to save it, but just in case it gets misplaced, it's your homework assignment to send it back to me. Is that okay? Okay, here we go. Let's see what other questions we got here. Thomas, I'm gonna get to that one on the weight gain. I'm gonna get to that one in just a minute. So Tom says you can have 20 different issues when it comes to socket fit, and he's absolutely right. Lots of them could deal with the socket, plus you could have adherent scar tissue that shows up when you're sitting in a socket. You could also have an aroma or a sloppy surgery. Surgeons get paid poorly, so you get into a tough spot when you think about that. And Thomas, basically, he's just like taking the tip of the iceberg, guys. When it comes to making a socket, like I said, it's science and art. And this is where so much of the training comes into play for these prosthetists. And I'm only talking about a little part of it. Obviously, the making of the socket, the alignment of a leg, these are just probably, if I had to think about it, the 2 biggest key components in a prosthetist job, right? To make a well-fitting socket and a well-aligned leg. And yes, there's so many factors that go into making a comfortable socket. I will say this, Rob, it can be a 2 steps forward, 1 step back process. And this is something that we've discussed a lot on the show, and I will continue to discuss because a lot of folks get very discouraged. Even folks who have a beautifully shaped limb and it's just that nice, pretty conical shape, and there's just a little tiny little scar line and there's no other issues going on, they can still have issues with socket fit. And sometimes it can take multiple visits to the prosthetist to get that socket fitting properly. And even once you get the socket fitting properly, you still may need to go for maintenance because of the fact that your limb volume and your body is going to change over the course of time. Okay. So one thing I tell you, and I know it's really hard not to, but I try to tell people, please don't get discouraged if you find that you're not getting that perfect socket fit that very first time. One example that comes to mind right off the top of my head is Amy Purdy. I don't know if some of you all are familiar with her. She is a Paralympian in the winter sports, and I forget exactly which one was her winter sport. She took a bronze or silver bronze. I'm sorry, I forgot. She's a bilateral below the knee amputee, phenomenal athlete, an elite athlete. And she recently, in the past few years, had health issues that required refitting of sockets. And she's going on 2 years now trying to get her sockets to fit her well enough so that she can be as functional and as active as she was prior to those issues. And we're talking about a Paralympic athlete. And how much she's having to struggle in getting those socket fits. Okay. So, it's one of those things where I don't want to discourage people by saying, yeah, it's kind of a pain in the neck, but sometimes I feel like if you understand that the process is going to take time. Hopefully it'll take some of that anxiety out of it as to why it's not working right away. Does that make sense, guys? Here we go. Jeff says, I have to have a new socket made because I shrunk too many shims, so I had to add some adjustments. It's not fitting well, makes me not want to wear it or walk with it. And guys, that is that just makes me go, there was actually a research study done, and it said the number one reason people abandon the use of their prosthetic leg, socket discomfort. Right? It's not even because they didn't have the most high-tech bells and whistles foot or knee. It's because of socket discomfort. And it just makes me go, oh, when I hear that from someone that they say, oh, my prosthetic leg is just sitting in my closet because it doesn't fit well or it hurts, and it just kind of frustrating. And I've said this on several occasions back when I first started practicing as a physical therapist, we had wooden feet and door hinges for knees, but because the prosthetist that I worked with was phenomenal and the sockets fit so well, we could get these folks walking like supermodels. So it really, truly, don't underestimate the beauty of a well-fitting socket. Let's see. Scott says, first flight as an amputee with a new leg, swell or shrink with cabin pressure? Yes and yes. Scott, for the most part, and guys, please chime in. I want to hear you guys chiming in with your expertise here because you're going to have experience with this. Typically what I hear is that the limb tends to swell a little bit with flight. So there's a couple of little hacks that I've picked up from some of my amputee friends. I know that Reggie Showers, he's been on my show like a million times. He's practically my co-host. He's a bilateral below the knee amputee, and he's been one for over 40 years now, right? And he travels all over the place. He says that when he goes on a plane, once he sits down in his chair, he will take his prosthetics off and take off a sock or two and then put his prosthetics back on. And that's just to kind of give his residual limb a little room to kind of swell because he knows he's going to swell during the flight. So he's just already accommodating that. And he says he tends to leave his legs on because the pressure of having the socket on helps mediate how much his leg will swell. And there's a couple of different ways. And guys, this is something where you have to kind of guess and check to see what works best for you. Some people I know, they leave their leg on the entire time. And again, they might adjust the socket fit with the socks. My folks who have the adjustable socket, this is where this really comes in handy because they can adjust it without having to take the socket off. Now, there are some people that I know that this is where their shrinker comes in handy, that they might opt to put their shrinker on, and they might pay the extra $50. I think it's like $50 nowadays to get the seat with just a little bit of leg room so that they can elevate the residual limb. So they'll take their prosthesis off, put the shrinker on, and then elevate the limb. And that hopefully helps mediate some of that swelling that can occur in flight. And again, I always say, like, the first time that you fly, if you've never flown before with your leg, I would say just kind of take your plan B with you. Plan to hopefully have somebody meet you at the gate with the wheelchair just in case you need it, just in case your prosthesis doesn't fit after the flight. Take your walking aid with you, whether it is that you use your crutches or your walker when you're not wearing your leg, again, just in case your leg decides not to fit, and at least you can get on and off the plane with your crutches or your walker. And then after you take that first flight, y'all are wonderful. Y'all, adjusting to what you need to adjust to. So after you take that first flight, you're going to know, okay, I need to have my shrinker, I need to have my crutches, or nope, I just kept my leg on and I was just fine. Other thing when you're going on flights, drink like a fish. And I don't mean the little bottles. I mean, drink lots and lots of water, because this can really help with preventing of swelling. Unless you have kidney issues, right, where you're on water restrictions, drinking water and keeping yourself hydrated, believe it or not, helps prevent swelling, which I know that sounds counterintuitive. And the other thing is when you're drinking a lot of water, it means you have to get up and use the restroom, which makes you walk, which helps pump the fluid and the swelling out of your leg. See how that works? Yes? Okay, guys, throw in some comments in there. Those of you who travel and go on flights, what are your tips and tricks for that, please? All right, let's see. Instagram, popping over to Instagram. Let's see what's going on over there. Ooh, got a lot of people joining on Instagram. Let's see. Flyanne says on Instagram, my hubby bought me a box of chocolates, and in his true fashion, they were upside down. Is that on accident or is that on purpose, Flyanne? You got to tell me the story about that one. Let's see. And she also says, Flyanne says, I also have gotten a bursa and a hematoma with an ill-fitting socket. Yeah, guys, a socket can either be your best friend and your key to mobility and independence in your life, or it can cause problems. So this is where I tell you, especially if you're new to wearing a socket, if you're working with a new prosthetist, politely squeak the wheel. Politely squeak the wheel. When you feel something in your socket and you're not sure if what you're feeling is normal or not, communicate this to your prosthetist, and they will either tell you, yes, that's part of the normal process, or nope, come on in, or this is how you need to troubleshoot this feeling. Okay. I can tell you this, guys, pain is always a no-no with a socket. Always. There can be discomfort when you're getting used to a new socket, especially if it's your first socket, but there should never be pain. Okay. Pain is your body trying to tell you something ain't right. Something is not fitting well. Okay. And we don't want it to get to the point where you're having a bursa or skin breakdown or any of these kind of issues. Okay. So, and I know I sound like I'm really like, but again, every time you have one of these issues that leads to bursa, that leads to breakdown, that leads to a neuroma flaring up, it means you got to be out of your socket and you're out of commission for a while. And who's got time for that, right? All right. Mm-hmm. Let's see what else we got. Randy says that you were looking for me on Facebook, but it hasn't shown up yet. Huh. It shows that I'm broadcasting to Facebook, Randy. So hopefully, but I'm glad you found me on YouTube. So guys, just as a reminder, I'm broadcasting to YouTube, Facebook, and Instagram. Ta-da. Okay. Hey there, Harsh. Thanks, Pastor David. Scott says, pain management doctor discussed doing spinal stenosis thoughts. I hadn't heard of it for phantom pain. So Scott, I think I know what you're trying to ask me, but you correct me if I'm wrong. So when it comes to spinal stenosis, stenosis just means closing in, right? So it can be changes in the spine with age and with injury and over the course of time, where the spinal canal starts to shrink and it kind of starts to pinch up on those spinal nerves. Now, could that be a potential cause of your phantom pain? Yeah, there's a lot of different causes for phantom pain, and many of which we're still trying to figure out. But if you have determined that your phantom pain is coming from spinal stenosis, if your doctor has been able to accurately pinpoint that trigger, then yes, it would definitely be worth discussing with a pain doctor or with a neurologist to see what are the pain management options that you would have, whether it's a medication, in extreme cases, maybe even surgery to relieve the pressure there, depending on how much of a stenosis there is going on right there. See, Drew says it took 6 prosthetists, holy smokes, until one determined I had a neuroma. 2.5 years wasted. Found a few bone spurs, no more sockets for me, got cleared for OI, and hope it works out. Drew, I think you'll find it's going to be a very positive experience for you. Guys, I've done many shows on lost my train of thought there for a moment. I've done many shows on neuromas and how they can be treated, as well as shows on osseointegration. We actually have a show coming up next week on osseointegration, guys. I'm going to do the plug right now for it. The man who invented osseointegration, and it's very rare that you can say someone invented something. So he and his father are the creators of osseointegration. We've had many folks since then develop different types of osseointegration and different surgical procedures for this, right? But in terms of the original, the OG, the original gangster, as my teenagers would say, we're having him on the show next week, and I'm really excited. And guys, even if you're not thinking of osseointegration for yourself, or you don't think you're a candidate, that's fine. I would just encourage you to come to the show and ask your questions, because you're going to get the original resource, the original person who created this amazing procedure. And I've been doing a lot of reading on the research and the statistics on this procedure, and there's a lot of things that are incredibly promising in the future for amputee care. So this is something that I hope you all can join me next week for this one. Let's see. Robin says, a prosthetist should not always take the blame for the poor socket fit. You as a patient have to do your part and be compliant to the shrinker schedule and a million other things that are not always in his or her control. Excellent point. Maintaining your weight is part of your responsibility because the prosthetist is like trapping a cube of Jell-O. It takes time and patience on both ends. Absolutely right, Robin. And thank you for pointing this out. So guys, I talk a lot about, how the prosthetist has to do this, the prosthetist has to do this, but Robin's actually is absolutely right as well. As the patient, right? And I sometimes refer to you guys as consumers, not just patients, but consumers. And you need to be informed consumers. And part of being an informed consumer is knowing what the product is that you're using. And in your case, you're using a socket, right? So understanding what is your role. And thank you, Robin, for pointing this out. What is your role in wearing a socket and being able to wear a socket? It's understanding the wearing schedule, understanding how residual limb volume works, right? That your limb is going to be changing volume, especially in those first 1.5 to 2 years after amputation, right? And what is your responsibility in terms of troubleshooting the socket and the wear of the socket? And again, there is a learning curve here, right? It's a two-way street. Prosthetist has to give you education. Physical therapist should also be giving you the education, and you need to be compliant with this education, right? Doing what you got to do, as my friend would say, do the things, right? He just says that, do the things, right? And then giving the feedback. Okay, so it really is, it's a dance between two parties here. Okay, thank you, Jeff. Thank you, Dave. All right. Jerry says, I love Amy Purdy. She's an inspiration to me. Being a bilateral. Ups and downs are good to know because it helps to know it's not always going to be good and it's reality. And, I do appreciate Amy. She really, in the sense that she puts the reality of what she's going through on her Instagram pages, the good, the bad, and the ugly, right? And, she even says, someone like herself who has the resources that she has available, and there's struggles there. There's some very, very real struggles in finding that socket fit. Yes. So osseointegration, again, it does take away the issue of the socket, right? You don't have to deal with the socket anymore. You have other things that you have to work with, right? You are dealing with a very invasive surgery and a recovery process that can be very lengthy. And there's a lot involved there. We're going to be talking all about that next week, Let's see. Nikki says, Earl from California, great show. Working with Hanger Clinic for my first AK leg. Finished the test socket today. Congratulations, Nikki. That's a huge step when you get that first check socket. Nikki, because I'm a PT and I got to say it, I hope you're working with a physical therapist to help you really check out that check socket. I got to come up with a better tagline. All right. Let's see. Hey, there's Rob from the Limkine Foundation. I'm going to give a shout out to Rob right there, man. Thank you for joining in, man. It's always good to see you. We got Sean Brown in the house as well. Let's see. Rob says, I always have my mentors keep their liner on during the flight over our long trips. They would never get back their leg upon arrival. Absolutely. So guys, just to give you the quick lowdown on Rob. And Rob, if you want to put a link in the comments section to your organization, Limkine Foundation, this man has a heart of gold. He is an amazing prosthetist in his own right. And then he has this beautiful foundation where he goes around the world providing prosthetic legs to children around the world. And I know he's been in Kenya. He's been in the Philippines, Sierra Leone, I think. Rob, correct me if I'm wrong. And I can't wait someday in the future to go out with him on one of these trips. So he's saying that he has his folks keep their liners on during their flights, because obviously they're taking really long trips if they're going out to Kenya, because they won't be able to put their leg on otherwise. All right. And no, Marianne, you are correct. Osseointegration is not for everyone. And even the folks who are coming on the show to talk about osseointegration, they will also be the first one to say, no, it's not for everyone. But it's becoming another, how did the one surgeon said? He goes, it's becoming another tool in the amputee bag. Okay, so now it's become an option for many surgeons to consider when it comes to what is going to be the best outcome for their amputee patients. Okay. Oh, you found me, Randy. Good. Okay, let's see. We got Carolyn coming in from Crayfordville, Florida. I have never heard of Crayfordville, Carolyn. Where is that located? Um, so Scott says, referring back to the spinal stenosis, she suggested that without any x-rays or tests or anything. And again, Scott, I don't know you. I don't know your case. I don't know your pain doctor. When it comes to spinal stenosis, there are examinations that both a doctor and a physical therapist does to kind of narrow the field down. And there's definitely, parts of the physical examination that we will do on a patient that might alert us to the possibility of spinal stenosis, or at the very least, something coming from the spine. Right? There's certain signs and symptoms and things that we look for when we examine patients. Definitive diagnosis, I think it needs to be with an X-ray or an MRI, definitively, right? And then when it comes to determining if the phantom pain is truly coming from spinal stenosis, again, there's a couple of other things that they would need to rule out. So Scott, one thing I would just ask her is, well, what led you to thinking that my spinal stenosis is causing my phantom pain? What are other things that could be causing my phantom pain? And just have your doctor explain to you their rationale and just their way of thinking, just to see. And that might lead to just more questions on, well, do you think we need to test for this or that? So for example, would she think that you need to test for a neuroma? Could that be causing your phantom pain? Okay, so just asking these questions sometimes can prompt the clinician to explain things better and explain their way of thinking in a way that makes you go, oh, okay, that makes sense. Or it might lead to a different path that makes them go, maybe we should be testing for this instead. Yeah? Okay. Oh, let's see. We got a few people joining in again from the Instagram. Those of you watching my Instagram channel, don't be shy. Feel free to put a question into the comments section. I keep popping back and forth between both screens there. Let's see. Tracy's. Oh, hey there, Tracy. Haven't seen you in a while. Let's see. Robin says, I'm the mom to a young prosthetist, and I'm also an above the knee amputee of 13 years. Give the prosthetist a break, learn to be a partner, and communicate with them and work as a team. All right. Here we go. So Limkine, Ram is telling me he goes to Haiti, Ethiopia, Kenya, Sri Lanka, Philippines, new location, Zambia this year. Holy smokes. That's awesome. All right. We got Nick, who's a left below the knee from Canada, and I'll be flying to the Dominican Republic on Monday. I'll be keeping my leg on for the flight for sure. And again, it's just, everybody's a little bit different with their flight, habits and what they do and what works for them. Yvette says, it's too hard to find a good AK prosthetist. Maya's trying to get me for my money from the insurance. And again, guys, I know I sometimes sound like I'm being tough on prosthetists, but number one, I'm also tough on the physical therapist. I'm tough on my colleagues. 99 out of 100 prosthetists and physical therapists, they're good people, right? They got into the field because they wanted to help people. They wanted to improve the quality of life of folks, and specifically with amputees and helping them learn how to walk again. Occasionally you run into one that's just not a good fit. Okay. And there's nothing wrong with moving on from that. When it comes to the fitting of a prosthesis, and this seems to be a very popular topic this evening, it is equal parts science and art and experience. And I've said this on the show several times. Even the most experienced of prosthetists, right? It can take several times to get that socket fit correctly. Okay. One of the hallmark signs for me that a prosthetist is doing the right thing is when they keep going back to the drawing board to try to make it work for you. Okay. So if you have a prosthetist that is willing to keep going back and trying new things and to continue to adjust and continue to tweak and work. And guys, those of you who are my prosthetists on board this evening, please feel free to jump in with this as well. That's the mark of a good prosthetist, right? From a physical therapy standpoint, there have been times where I've had to see a patient more than once, multiple times before it finally clicked as to what is it that I need to address with the patient. And I tell this to my physical therapy students and new PTs that come into the field. When you first evaluate a patient, yes, you're going to be able to assess a lot. And the more experienced you are as a PT, the more things you'll be able to pick up on that first treatment session. But there are many times where it sometimes takes 3-4 treatment sessions before I finally really see what's going on with my patient. And I can laser in on what it is I need to focus my treatment strategies on. Okay. And in turn, my patient has to continue to communicate with me. Yes, this is working. No, this is not working. Yes, I feel like I'm making progress. No, I feel like I haven't gotten anywhere. And guys, it's the same thing with your prosthetist. Okay. You have a prosthetist who has years of experience, but you are completely different from their other patients because you're unique. Okay. So again, if you're struggling with your socket fit, if you're struggling with the comfort of your socket, communicate with your prosthetist. And the prosthetist that keeps going back to the drawing board to want to continue to help you, that's the prosthetist you're going to get success with eventually. Okay. I know, Rob, you keep saying you're going to get me on a trip soon in Cuba, man. If you get a contract with Cuba, I'm there. I'm there. Cheers. Hey, we got Don coming in from Vancouver and with his protein shake. Don, give me an update. How are you doing? Okay. Josh says, in 38 years, I'd say it's more on the user to get a good fit. A lot of amputees don't realize sometimes they're only advocate. Being a prosthetist is a lot like a doctor. Everyone is different. Everyone has different spots that can cause problems. As far as weight gain going, that's a huge side effect of nerve pain meds. It's always more calories out than in, and you'll be all right. Obviously, retaining water can be a problem, but you can speak with your doctor about that. Okay, so guys, let's talk a little bit about that. I actually did a show, and let me copy this link really quick because I want you guys to watch this show later on. All right, so I'm posting in the comments section. Okay. In the comments section, guys, I did my first show on weight management after amputation. I did it back in November with Reggie Showers. It's a great show. I'm actually really proud of that show. So let's talk a little bit about weight management. Before I say anything, I have to say I am not a dietitian. I'm not a registered dietitian. Dietitians are the licensed professionals when it comes to weight management in terms of diet and nutrition, okay? As a physical therapist, I am able to give general information when it comes to weight management and nutrition. Okay. So, and this is, what I want to talk about tonight is a little bit based on both professional experience of working in the healthcare industry for over 20. I've been in the healthcare industry now for 30 years. Good gravy, that's a long time. 23 years as a licensed therapist. And then also just from personal experiences. When it comes to weight management after amputation, right? So the statistics are not hard to find, guys. You can Google search weight changes after amputation, and you're going to get a whole slew of research studies. The particular ones that I looked at were ones done with veterans, and these were done, it was studying a cohort of veterans who lost their limb when they were young, and also a cohort of veterans who lost their limbs after they were retired, meaning not related to service. And it wasn't a big surprise. There was a statistical analysis positive for weight gain. The younger folks did not gain as much weight as the older folks did because of the more activity with the younger folks, right? So what is going to cause weight gain after amputation? The number one thing is lack of mobility. That's usually the biggest culprit right there. Right? You have an amputation, and even if you were ambulatory before your amputation, let's say you were walking around and you were doing pretty good with your mobility before amputation, after your amputation, you're looking at 4-6 weeks probably before being able to be fit with a prosthesis, and your mobility has decreased. Right? So you're not as active, you're not moving around as much, and that's just going to happen. And that's one of the biggest contributors right there. And then once you get your leg, it's going to take you a few months before you're mobile again and potentially moving around in the same manner as you were prior to amputation. And that's like the nice, pretty textbook scenario, right? But for many folks, there's delays, there are issues with wound healing, there are medical issues that can crop up. And again, it just delays the return of mobility, right? Another thing that I find, the comorbidities. What do I mean by comorbidities? Medical issues that were present in your body. So whether this is related to hypertension, high blood pressure, diabetes, autoimmune disease, right? All of these diseases, and I say this a lot, are still present in your body, even though the surgeon amputated your leg. Okay. And a lot of these can contribute to weight gain, whether it's weight gain or weight loss, right? So if you're having issues with your diabetes and your sugar is not under control, if you're having issues with your blood pressure and that is not under control, right? It can lead to changes in your weight. Some of that weight might be due to water retention and edema. Some of that weight gain might be exactly that, weight gain, fat, adipose tissue that is collecting. Okay. And again, everybody's a little bit different. Okay. And then on top of this, and this is another layer that I'm really starting to kind of just read up on my own more and just really start to respect a lot more, is the effect of the aging body, the effect of weight as we age, especially in our female population. There is so much that we are learning right now about the impact of hormones, both on men and women. Men don't get away with a free one on this one. But obviously with women, right, there's a lot going on with the hormones and everything we're learning about how that can contribute, not just to weight gain, but just to our well-being overall, right? And we're starting to see more autoimmune cases coming up as we get older. We start to see other things that start to crop up. And all of this contributes to weight management. Okay. And this can happen whether you have an amputation or not. So there's a lot of layers to this. Now, guys, if you watch the show that I just posted, I'm going to go ahead and post it again, because again, I really, really like this show. I like what I did with this show because I had everything, just kind of a little bit of everything included in this show. And also just different options as to what you can look at when it comes to weight management. Okay. And I give you a lot of resources in that show as well. When it comes to weight management, to me, it is just as important as it is to address mental health after amputation, as it is to address socket fit after amputation. And the big reason is it's such a huge contributor to your recovery process. Okay. Weight gain, the first impact is, the fit of your socket, right? If you're gaining weight, then no matter how good that prosthetist is, that socket's not going to fit, right? And you need to be able to figure out how to manage your weight in a reasonable manner to be able to maintain the fit of your socket. Number two, body image, right? We all want to have our healthy body weight. It makes us feel good. It gives us that self-confidence that we need. And I hear that a lot from my patients when they say, man, I just don't feel like myself. Not only have I lost my leg, but I'm also 20 pounds heavier. My clothes don't fit. I don't feel well. I don't feel right. That's all contributing to, just the recovery process right there. Okay. Number three, weight management when it comes to walking with a prosthesis. And I tell my patients this, they say, it's only 5 or 10 pounds. And I go, yeah, but just think about strapping a 5 or 10 pound weight to your back and then walking around with it. Right? So if you can maintain a healthy weight, it's going to make your efficiency with walking a lot easier. Okay. And I'm not saying we all got to be skinny, twiggy little supermodels walking around, but maintaining a healthy weight is going to make it easier for you to walk. It's less stress on your joints. It's less stress on your system as a whole. Okay. And guys, I understand it is not easy. It is not easy, with losing weight, maintaining weight, especially when you're dealing with impaired mobility because you're perhaps not walking the same amount as you were with your leg as you were prior to your amputation. And this is where I really advocate for investing in this part of your health. And again, in this particular show that I just quoted right here, there's many resources available nowadays. Okay. I highly recommend the services of a licensed dietitian. Okay. And there's a difference between a dietitian and a nutritionist. A dietitian is a licensed clinician. A nutritionist is not. Okay. Another route that I have been exploring myself on a personal level and also on a professional level is functional medicine. So there's a lot of, and again, this is where you have to do your homework and make sure you're getting a licensed professional with this. There's a lot that we're seeing with functional medicine in finding how to treat the body and how to, what's the tagline? Using food as medicine, right? Using our nutrition to help heal our bodies and to really nourish our bodies and to help treat our bodies well, right? And that's a whole nother field right there. That's something that you need to go and explore and read up on. But guys, in a nutshell, okay, when it comes to weight management, especially if you're struggling and you're realizing that the calories out versus calories in is formula is not necessarily working for you, I would highly recommend that you look at the services of a licensed professional, a licensed dietitian. As a physical therapist, I've referred many of my patients to dietitians because I think you need someone who is the professional expert on nutrition there. And also that accountability and to have that support, Yes. All right. I saw a lot of comments flying in, so I'm going to go back and read some of these comments. Let's see. Gustavo, ¿de qué hablan hoy? Oh, Gustavo is my physical therapist from Argentina and he likes to tune in. Me alegro que le esté yendo bien con su paciente. Gustavo, estamos hablando un poco de la nutrición y de cómo manejar el peso después de amputaciones. All right, so let's see. Hey there, Helen. Thanks for joining in. Susan says, my husband and I did a 5-day fasting mimicking diet in January, helped get rid of holiday indulgences. And again, guys, when it comes to, because there's like, good heavens, 20 different camps of weight loss and weight management systems. You have South Beach diet, you have keto, you have low glucose, you have low carb, you have like traditional Weight Watchers type diet system. You have, gluten-free, dairy-free, vegan, vegetarian, all over the place, right? And then you have folks with the camps with the fasting and this and that and the other. Whatever it is that you decide to do, please do it responsibly. Go do it under the guidance either of your doctor or a dietitian who is licensed to help with this. When it comes to fasting, yes, there are definitely benefits of fasting. There's so many different ways of fasting. So again, this is something that needs to be done under the supervision of a healthcare professional, right? If you do it the right way, it can work. If you don't do it the right way, it can be a disaster. So again, just highly recommend, and not one size fits all, guys. Okay, not everybody is meant to do fasting. It is not meant for everyone. And I think that if it's going to be done, you need to do it with the supervision of a healthcare professional. Tracy says, I lost a lot of muscle. Yes. And let's talk a little bit about that, guys. Muscle, along with powering your gait and making you look good in your blue jeans, right? It also provides metabolism. It helps metabolize the glucose in your body, right? So that's why it's actually a huge recommendation for women as we age, as I'm learning myself, right? That the more muscle we have in our body, the more efficient our body is with metabolizing glucose, right? So especially for my diabetics and my women who are getting older, this is a really great tool. Okay. And again, this is something that is lost during those initial stages after amputation because you're not as mobile, right? And again, this is where your neighborhood friendly physical therapist can really come into play in helping rebuild this muscle. Okay. Brian says, hi all, as a prosthetist and amputee, ballpark beef hot dogs, so delicious, but cause my legs to hold more water and I have to use less socks to get my legs on. Yeah. And guys, we all know, we all know what it is sometimes in our diet that will trigger either to hold retention or to really start to pack on those pounds. And again, for me, I kind of adopt the mentality of, we're meant to enjoy our lives. So, find a diet plan that will fit your lifestyle. And that's something that I've learned also along the way with my patients. We have so many diet plans and so many think tanks when it comes to weight management. Find the one that's going to work for you. Find the one that will work with your health status, right? And also find the one that lets you have a little bit of fun. In my own personal diet plan, I'm a runner, so there's a lot of things I do for my nutrition, especially when I'm training for a race. But I have an 80-20 rule. 80% of the time, I'm eating beautiful, healthy food, good, nourishing food. 20% of the time, it's usually on a weekend night, I go and I have my hot dog. And right now, it's my 20% of choice is the hot dog and strawberry milkshakes because we have our in strawberry season right now. But anyways, sometimes you just got to enjoy that hot dog. Dawn says, I'm doing great. Now I have my protein level again. Yes. And I'm using collagen in the wound with wound care nurse time 3 times a week and getting progress after 3 months with a vac. Dawn, I am so glad to hear that. So glad to hear that. Let's see. Sean says, does having an amputation can cause high blood pressure due to the fact that you need to have the same amount of blood to live, but you have less body for blood to travel through? That's a really good question, Sean. No, I haven't heard necessarily an amputation, like just an amputation by itself, causing an increase in blood pressure. Usually what happens, especially in my older population, is there's already a problem with blood pressure there. And it's not necessarily exacerbated or made worse by an amputation. Usually it's the lifestyle choices sometimes that will make that blood pressure worse, or if it's not being controlled well with the medications, right? So it's kind of a fine dance between the two. To control blood pressure, sometimes there is the need for medication, but also there's a lot of lifestyle factors that can play into that as to whether it's going to stabilize or get better or get worse. Josh says, I was just going to go there. In my opinion, amputation is 90% mental. Going through the stages of grief, you can really get stuck in depression and other problems. I always encourage every amputee I visit in the hospital to start talking with someone. Yes. And again, recovery from amputation, recovery from any physical trauma to the body. So in my personal case, I have a history of breast cancer, and I was diagnosed at a younger age, right, with 4 children. Recovery from breast cancer and also from amputation, to me, it's a 3-part. It's physical, emotional, and spiritual, right? And you have to address all 3. And sometimes it's a lifelong process of healing. I'm 7 years out from my cancer diagnosis, and there's still things that I'm healing from, right? And that I will continue to heal from. But certainly mental wellness is definitely huge, just as important, if not more so, than the physical side of it. And sometimes the weight can play into the mental wellness, right? Our body image is already impacted by what we've gone through, whether it's breast cancer or amputation of a limb, right? Our physical bodies go through these incredibly dramatic changes, and we're still trying to adjust to those changes in our bodies, right? And then on top of that, if we're gaining weight, if we're losing weight, right, all of that is just affecting our body image. How can that not affect our mental well-being, right? So addressing that, right away and trying to get that support is just so important, guys. For myself, I have a functional medicine practitioner that I work with for my nutrition and for maintaining my weight as well. And that's something that, I realized over the years after cancer treatment that I needed to really have that come into play. And certainly for any of my amputees that I see that are struggling with maintaining a healthy weight, the sooner we can refer them to somebody who can help them out, the better we can get there. Nick says, I am 6 months post-amputation. I definitely got fat since amputation. I'm just now trying to get rid of my new belly, and I've always been fairly fit, and I hate diets. I know, Nick, I'm right there with you. And it's funny, like, here, let's just do this is just a fun COSI poll. There's the camp that says, I will run and run and run or work out and exercise till the cows come home, but please don't ask me to diet. And then there's the camp that says, I will diet till the cows come home, but please don't ask me to exercise. Which one are you? Like, do you prefer to exercise or do you prefer to manage your diet? I'll be honest, I will run till the cows come home, but please do not take away my donuts or tell me that I can't have my big bowl of spaghetti. That's the part that I struggle with most when it comes to weight management and my nutrition, is the nutrition part. Like, that's the part that for me, I will run and exercise. And I have some friends of mine that they're like, no, please do not make us exercise. We will control our diet and everything and behave there, but please do not make us go out and exercise. So I'm curious, guys, go ahead and put it in the comment section. What is it easier for you to do, to control and manage your exercise, or to control and manage your diet? Yvette says, I found using ice packs at night so that I'm not taking a lot of medicine, and it helps so much. David says, frustration, anxiety, age, comorbidity, weight issues, staying active, and more. It can all stack up so quickly before you realize it. Amen to that. Let's see, Sean says, depression can cause you to eat more than usual because you're not as active as you once were and having a lot of extra time to sit around. Yes, and eating as an emotional coping mechanism. Been there, done that. Yep. Hey there, Kathy. Pam says, also, if you need to have surgery, make sure the anesthesiologist uses your weight without your prosthesis. I was accidentally overdosed and had difficulty coming out of anesthesia. Yep. Okay. Kind of scrolling through here, guys. Gustavo says, I work with a nutritionist, but in bilateral amputee patients, these patients can be rebellious. Sorry, my English is bad. So I understand what Gustavo is trying to say, is that it can be just a bit more of a challenge. And this brings me kind of to my next comment. And this question comment was brought to me by a fellow physical therapist. So Patrick is a physical therapist who's been listening to the show for several years now, and he's a colleague of mine over in New York. And he has worked with amputees as well. And he says he wanted me to comment on compliance with overall rehab and recovery with the limb loss community, services available to those struggling, and roadblocks that can prevent them from moving forward. And he said, I opened a new case of a right above the knee amputee from years prior, and could see the outcome that she was eventually headed towards amputation because of not wanting to be compliant with other things. So let's talk a little bit about that, guys. So we talked a little bit about the importance of how to communicate with your prosthetist, right? Your needs when it comes to your socket. But also, we're kind of diving into the compliance. And what does that mean? Compliance meaning a person's ability to follow the treatment protocols, right? And to stick with it, for lack of better phrasing, to stick with it. And I will tell you that that is probably the largest contributor as to whether a person will be successful or not with using a prosthesis. And after amputation, it's compliance with the treatment and the recommendations, right? So in a perfect scenario, if you have a prosthetist who is just gung-ho about wanting to help you, you have a physical therapist who is specialized in amputee rehabilitation, your job as the patient to continue to do the things, as my friend would say, do the things that need to be done. That is what's going to determine the success with your therapy. And that's going to determine the success with using your prosthesis. And this is not any kind of fancy research study. This is just me, 23 years in the field, right? Working with patients of all different kinds: stroke patients, spinal cord injury patients, burn patients, trauma patients, amputee patients, right? The single common denominator to the success with these patients was compliance with treatment. Okay. And this is something that with amputee patients is extremely challenging. I think more so than some of the other pathologies that I've treated. I've seen more prevalence of depression, more prevalence of post-traumatic stress that sometimes progresses to post-traumatic stress disorder, PTSD, in my amputee patients, which can be a domino effect to leading to less successful outcome with the prosthetic devices. If there's any clinicians here that want to chime in with this, please feel free. And the more time that I've spent working with amputee patients, the more important it is for me not just to address their gait needs, but to also look at their entire lives to see what is going on, what referrals can I make for them, how can I connect them with the people to give them the support that they need. So whether it's because they need to be connected with a certified peer visitor from the Amputee Coalition so that they can talk to another amputee that has a similar amputation, that is a similar demographic as possible, whether it means referring them to the dietitian to help them with the weight management, to help get their confidence up and to help them just feel better physically as well, whether it means making sure that they're getting their follow-up appointments, right, with their vascular surgeons to make sure that their leg that is still intact is staying healthy, right? Making sure that they're having their follow-up appointments with their endocrinologist to make sure that their diabetes is being well managed. Okay. It takes a team to help a person become successful after amputation. And being compliant with your team and being compliant with the resources that are hopefully being provided for you. And if the resources are not being provided for you, that you continue to try to be an advocate for yourself to get these resources. So we could have so many shows on that one, but that's just kind of like the nutshell on that particular subject. See, Blue Diva says physiotherapy is so important to do daily as part of our maintenance of using our prosthetics to their fullest. Physiotherapy is a lifelong commitment, not just for the first few months post-op. Blue Diva, you are my favorite viewer tonight for saying that. Thank you so much. And that's exactly, she just piggybacked exactly what I just said. And that, again, that plays into the compliance there, guys. So, with physical therapy, it is a lifelong process, and it's not just for amputees. It's for folks who are not amputees, right? We have to use it or lose it. We have to maintain as we age so that we can continue to do what it is that we love to do. Nicholas says, question off topic. I will be having spine surgery, laminectomy, and fusion surgery. Anybody have this done? Any types of tricks? Nick, number one thing when it comes to laminectomy and fusion surgery, and they're going to be going over this with you post-op, they're going to have some very particular post-op protocols and indications and contraindications, meaning things that you are not supposed to do after this particular surgery. And your surgeon's going to be going over this with you. Follow this. This plays into the compliance I was just talking about. When it comes to back surgery, and guys, I worked in the spinal cord injury unit for really long time, several years at Jackson Memorial Hospital. So I saw a lot of spinal surgeries, right? Biggest successful outcome is when the person was compliant. That seems to be the vocabulary word of the evening, with the surgical protocols, right? The do's and don'ts. And there are very specific do's and don'ts after these type of spinal surgeries. The tricky part is when the person starts to feel better, probably like 3 to 4 weeks after their surgery, they start to do things more and more when they shouldn't be, right? Some of these surgical protocols last 6 to 8 weeks, sometimes even 12 weeks, depending on the spine surgery and depending on the spine surgeon that you've had. So following these protocols to the letter the full time is the first part of having a successful outcome from some of these spine surgeries. And the next part, Nick, you're probably already guess what I'm going to say is, drum roll, physical therapy, right? So after the spine surgery has healed and your surgeon has cleared you for physical therapy, get thee to a back specialist. And thankfully, there's a whole lot of back specialist physical therapists out there. You can turn a rock over and find 10 of them. And they don't necessarily have to be amputee specialists, all right? These kind of PTs are the ones that are going to strengthen your core. They're going to strengthen your entire body to make sure that this surgery holds and has the support it needs, okay? When it comes to these back surgeries, you want it to be a one and done, okay? I'm going to be very blunt about that. You do not want to be the revolving door when it comes to spinal surgeries, okay? And there might be some of you out there who have had more than one spinal surgery and you're going, yeah, I'm that revolving door. Okay. If you are, get thee to a physical therapist, right? That's the second part of having a successful spinal outcome surgery, is when you have the muscles and everything strengthened around that surgery to keep it nice and stable. Savvy? All right. Hey there, Tom. Oh, glad you got your ashes there, Tom. Rob says, on an AK amputation, can the muscle in the residual limb be regained? I get conflicting information. So Rob, I'm going to make this a really clear answer. Yes and no. Okay, so here's the deal. When they transect the muscle, right, unless there's nerve damage of some sort, right, that muscle is still receiving nerve impulses. It's still capable of contracting, right? The difference is that it's going to be a shorter muscle and there may be less of it. Maybe they had to resect a part of it. I don't know. So it's not going to contract as efficiently as it used to contract because it's just shorter. So just basic laws of physics, right? Shorter lever arm, less power, right? So while it's contracting, it may not ever contract the same way it did prior to amputation. That makes sense, Rob? And then you also have to look at where it's attached. Sometimes they might have to take a muscle and attach it just a little bit differently after amputation. So again, the angle of pull, right, might be a little bit different. So it may or may not contract efficiently. Now we're starting to see more surgeries, and this is something I actually have to learn a little bit more on myself, like the AMI surgery, where they're attaching certain muscle groups together to help them contract a little more efficiently. Okay. But as my friend Reggie would say, we are never going to be able to recreate God's divine design with our bodies, right? Once we have an amputation, the natural alignment and design of these muscles will have changed. When it comes to AKs, am I still trying to activate the quads and the hamstrings even though they've been cut? Yeah, I'm still trying to get my amputees to activate them. My main focus is going to be on the gluteal muscles because those are intact and those are going to be the muscles that stabilize the hips and power the gait. But in activating the gluteal muscles, we will also be activating the quads and the hamstrings, right? So, and the same thing goes for my below the knee amputees and the lower calf muscles, right? We can still activate the anterior tib. We can still activate the calf, the gastrocsoleus, which is your calf muscles. They're just not going to ever contract the same way ever again because they've been cut. Okay. So you are going to notice a little bit more atrophy in those areas, but you still keep working them out. So I hope that clarifies that a little bit for you, Rob. Oh, sorry, we were getting back. So back to the poll where I asked you guys if you would prefer to exercise versus diet when it comes to weight management. Joan says camp both. Rob says exercise 100%. Blue Diva says exercise 100%. Let's see. Donna says managing the diet. Sean says exercise. Susan says I need to do both, eat well and exercise. Nick says exercise for sure. I like my ice cream. Tom says both. And guys, it's interesting. All across the board, doesn't matter what camp of diet plan, nutrition, think tank that you go to, they both say the same thing. You need both diet and exercise. And this also comes from the American Heart Association. Anywhere you look, right? Any study will tell you you need a combination of both. And one of my friends, she used to tell me, you can't outrun your spoon. I've tried. She's right. I can't. Hey there, Tracy. Love from Miami. Oh, it's always nice having someone from Miami on board. I have some nice memories from living there. Dawn says, love my spaghetti and I use zucchini noodles. I've done that too, and it's actually quite tasty. All right. Marianne says, as a widow, I do not eat well, but I do exercise a lot. You are one of the hardest working people I know, Marianne. All right, guys. I think... Harsh is saying, I hope you've not hurt on your forehead. Nope. I just had my ashes, my Ash Wednesday ashes, but my little cross has kind of gotten real smudgy because I went to the early morning mass this morning, like at 7 a.m. this morning. So now it just looks like I have a bruise on my forehead. All right. Okay, guys. I am going to close the show down right now. But before I do, guys, if you guys have been so wonderful this past couple of weeks in sharing my live videos. This really helps kind of get the word out and get those Facebook algorithms and all that kind of tech stuff going that I don't really know much about. But anyways, if you could please consider sharing this show to either your support groups or your personal pages if you so desire, I would greatly appreciate that. Next week, guys, Dr. Ricard Brandemark is coming on the show. He is the surgeon. He and his father created osseointegration. They are the OG, the original gangsters, right? That created osseointegration. I can't believe I just said that about my sponsor. But they'll be coming on the show to talk about osseointegration, like really where it all started. So guys, even if you're not an osseointegration candidate, even if you're not going to ever have it done, this is your chance to ask the person who invented this procedure the questions, right? This is who you want to ask your questions to, okay? So next Wednesday, guys, come and join in. I'm going to be sending out an email with giveaways. We've got some nice giveaways going on, folks. So those of you who are subscribed to my email service, go ahead and check your emails. Probably on Monday is when I'm going to send it out. If you're not subscribed to my email service, just go to www.kelseytalks.com, scroll to the bottom, and you can subscribe for my email service there. Okay. All right, guys. I am, the OGs. Can you tell I have teenagers in the house where I'm trying to keep up with the hip lingo here? Yeah. All right, guys. For those of you who joined me this evening, thank you so much. Happy Ash Wednesday. Happy Valentine's Day to you all. Enjoy your nights with your sweethearts. I will see you guys next week.